Health officials are urging calm after India confirmed 2 cases of the NIPAH virus, a rare but often deadly disease carried by fruit bats and animals such as pigs. The World Health Organization said on Friday the risk of national, regional and global spread is low. More than 190 people who had contact with the 2 infected patients have tested negative and show no symptoms.
Based on current information, the risk at national, regional and global levels is considered low. WHO will continue to closely monitor the situation in India and other countries, regularly continuing to assess the risk and provide technical support to local health authorities.
NIPAH virus can cause fever, respiratory illness and brain inflammation with fatality rates ranging from 40 to 75%. There is no approved cure and vaccines under development are still being tested. Despite the low transmission risk, several Asian countries, including Thailand, Malaysia, Singapore, Vietnam and Hong Kong, have tightened airport screening measures. Indonesia has begun using thermal scanners at major airports, including Bali, which welcomed nearly 6 million foreign tourists last year. First identified in Malaysia in 1999, NIPAH has caused small, recurring outbreaks, mostly in Bangladesh, with occasional cases in India. Since records began, around 750 cases have been reported worldwide, more than half of them fatal. The virus usually spreads from animals to humans, often through food contaminated by fruit bats, such as raw palm or date juice. Human-to-human transmission is possible, but experts say it typically requires prolonged close contact and does not happen easily.
26 January, India notified WHO of 2 confirmed cases of NIPAH virus disease in West Bengal state. As of today, no additional cases have been reported. The 2 cases are in a health facility receiving supportive care and didn't travel while symptomatic. No cases have been reported in any other country associated with this outbreak.
In India's eastern city of Kolkata, residents expressed a concern following the reports that the 2 recent cases were confirmed in Bengal, the state's first NIPAH infections in nearly 2 decades. Virologists say small outbreaks are not unusual and stress the risk to the general public remains low. The World Health Organization says it is still waiting for India to release genetic sequencing data to rule out any mutation, but stresses there is currently no evidence of increased transmissibility. Scientists caution that while NIPAH is dangerous, it has not shown signs of spreading easily worldwide, and note that airport screening may have limited effectiveness due to the virus's long incubation period.
Potential mutation, but there is no specific evidence that would make us worry for the time being and based on the information that we have.
Several vaccine candidates are in development, including one from Oxford University using the same technology as its COVID-19 vaccine. Phase 2 trials began in Bangladesh late last year with support from global health partners. For now, health authorities say vigilance, not panic, is the priority as monitoring continues and researchers race to develop effective treatments against one of the world's most lethal viruses.